As we grow older, many aspects of our lives change, including our health, our relationships, and how we experience intimacy. One area that often gets overlooked is sexual health. For older men, conversations about sexuality and sexual well-being can be difficult or uncomfortable, and sometimes, the assumption is that these concerns should be left behind as we age. However, sexual health continues to be an important aspect of overall well-being, even in later years. The reality is that many men experience changes in sexual function as they age, but these changes don't have to be permanent or debilitating. In fact, reevaluating your sexual health can help you address any concerns, explore solutions, and continue enjoying a fulfilling and healthy sex life. In this video, we'll explore 7 key reasons why elderly men should take the time to reassess their sexual health. From physical changes and health risks to emotional well-being and relationship satisfaction, there are many factors that can influence sexual function and intimacy as we age. It's time to open the conversation and take proactive steps to ensure that your sexual health remains a positive part of your life, no matter your age. As men age, it's natural to experience changes in sexual function. Conditions like erectile dysfunction, ED, decreased libido, and slower arousal are common, but these changes are not a sentence to a diminished quality of life. Many older men believe that these issues are simply a part of growing older, but this isn't necessarily the case. In fact, with the right approach, these challenges can be addressed effectively. Erectile dysfunction, in particular, affects a significant number of men as they age. ED occurs when a man has difficulty achieving or maintaining an erection sufficient for sexual activity. It's important to know that this condition can be caused by a variety of factors, including age-related changes in blood flow, hormonal shifts, stress, medications, or underlying health conditions such as diabetes or high blood pressure. While ED is more common in older men, it is not an inevitable part of aging. The first step in managing ED is seeking help from a healthcare professional. A doctor can assess your symptoms, identify the underlying cause, and recommend appropriate treatment options. These may include medications like Viagra or Cialis, which help improve blood flow to the penis, or lifestyle changes such as exercise, weight loss, and improved diet. In some cases, therapy or counseling may also be helpful, particularly if stress or emotional factors are contributing to the issue. There are also alternative treatments available for men who do not respond to oral medications. These may include vacuum pumps, penile injections, or even surgery in more severe cases. The key to improving sexual function as you age is recognizing that there are solutions available, and that you don't have to accept sexual dysfunction as an unavoidable part of growing older. Additionally, it's worth noting that even if ED becomes a challenge, it doesn't mean your sex life has to end. Many couples find new ways to experience intimacy that don't rely solely on traditional forms of sexual activity. Experimenting with different types of touch, communication, and emotional connection can help maintain a satisfying relationship. Sexual health is about more than just performance. It's about maintaining connection, confidence, and enjoyment in your relationships. By addressing changes in sexual function and exploring available solutions, you can continue to enjoy a fulfilling and active sex life. One of the most important reasons for elderly men to reevaluate their sexual health is the strong connection between heart health and sexual function. Sexual activity requires good circulation, and the ability to achieve and maintain an erection depends largely on blood flow to the penis. Therefore, issues that affect your cardiovascular health can directly impact your ability to perform sexually. As men age, they may develop conditions like high blood pressure, atherosclerosis, hardening of the arteries, or coronary artery disease, all of which affect blood flow. These conditions can lead to erectile dysfunction, ED, as the blood vessels in the penis may become narrowed or damaged, making it harder for the penis to fill with blood during arousal. ED is often one of the first signs of cardiovascular issues, and it can be a warning signal that something is wrong with your heart health. If you're experiencing ED, it's essential to take it seriously and talk to your doctor. A healthcare provider can assess your cardiovascular health and help you manage any underlying conditions, such as high blood pressure, cholesterol, or diabetes, that may be contributing to sexual dysfunction. Taking steps to manage these conditions can have the added benefit of improving both your heart health and your sexual function. In addition to seeking medical treatment, lifestyle changes can also make a significant difference in both heart and sexual health. Regular physical activity, a balanced diet, and maintaining a healthy weight are essential in promoting good circulation and cardiovascular function. For example, exercise can improve blood flow, lower blood pressure, and reduce the risk of developing heart disease, all of which can contribute to better sexual performance. Furthermore, reducing stress and managing mental health are also critical for both heart health and sexual well-being. Stress and anxiety can cause both physical and psychological barriers to sexual function, and chronic stress is a known risk factor for heart disease. Practicing relaxation techniques such as meditation, yoga, or mindfulness can reduce stress and improve both mental and physical health. Overall, the connection between heart health and sexual function is undeniable. By prioritizing heart health, you not only improve your overall well-being but also help maintain a satisfying sex life. If you're experiencing any signs of ED or cardiovascular issues, don't hesitate to reach out to a healthcare provider for guidance and treatment. As men age, one of the most significant changes that can impact sexual health is a decline in testosterone levels. Testosterone, the primary male sex hormone, plays a crucial role in maintaining libido, erectile function, muscle mass, and overall vitality. However, beginning in their late 30s or early 40s, many men experience a gradual decline in testosterone levels, which can continue over time. This natural reduction in testosterone can lead to a variety of changes in sexual health that older men should address and reassess. One of the most noticeable effects of low testosterone is a decrease in sexual desire or libido. Men may find that they no longer have the same level of interest in sex, or they may struggle to initiate sexual activity. Additionally, lower testosterone levels can make it more difficult to maintain an erection or experience sexual satisfaction. While these changes are normal with aging, they don't have to go unaddressed. If you're experiencing symptoms such as reduced libido, erectile dysfunction, fatigue, or difficulty concentrating, it's important to consult with your doctor. Blood tests can determine whether your testosterone levels are lower than what's considered normal for your age. If testosterone deficiency is identified, your doctor may recommend hormone replacement therapy, HRT, to restore testosterone levels and improve sexual function. There are various forms of testosterone therapy, including topical gels, patches, injections, and pellets. Each has its benefits and considerations, so discussing your options with a healthcare provider can help you determine the best approach for your specific needs. Testosterone therapy can significantly improve sexual desire, erectile function, mood, and overall well-being. In addition to medical treatments, lifestyle changes can also help support healthy testosterone levels. Regular exercise, particularly strength training, can naturally boost testosterone production. Eating a balanced diet rich in nutrients such as zinc and vitamin D, getting adequate sleep, and managing stress are also important factors in maintaining hormonal balance. However, it's important to note that testosterone therapy isn't suitable for everyone. Some men may experience side effects or may not be good candidates for HRT, especially if they have certain health conditions like prostate issues. This is why a thorough evaluation by your doctor is crucial before starting any form of hormone treatment. Ultimately, addressing low testosterone levels can have a profound impact on your sexual health and overall quality of life. If you're noticing changes in your sexual desire or performance, don't ignore the signs. Reassessing your hormonal health can lead to solutions that help restore vitality, improve intimacy, and enhance your enjoyment of life as you age. Mental health plays a vital role in overall well-being, and it has a significant impact on sexual health, especially as we age. For elderly men, emotional and psychological factors can profoundly affect sexual function and desire. Issues such as stress, anxiety, depression, and low self-esteem can create barriers to intimacy and diminish sexual satisfaction. As we grow older, many men experience emotional challenges that may affect their ability to engage in sexual activity or even feel motivated to pursue intimacy. Loss of a partner, retirement, feelings of isolation, or even the physical changes associated with aging can contribute to emotional distress. These emotional factors, in turn, can reduce libido, cause erectile dysfunction, ED, and hinder the ability to enjoy sex fully. The mind-body connection is powerful. Stress, anxiety, and depression can lead to physical changes in the body that affect sexual performance. For example, anxiety can trigger a stress response, releasing cortisol, a hormone that can impair the body's ability to perform sexually. Similarly, depression can decrease the desire for sex altogether, as it often leads to feelings of apathy, fatigue, and diminished self-worth. Additionally, aging men may also experience lower levels of confidence due to the physical changes that come with age. This decrease in self-esteem can further impact sexual health, creating a cycle of stress and dissatisfaction that can be difficult to break. Fortunately, there are steps that can be taken to address these issues. The first step is to acknowledge and discuss your mental health with a healthcare professional. A doctor can help you identify whether you are experiencing symptoms of depression, anxiety, or other mental health concerns that are affecting your sexual well-being. Treatment may include therapy, counseling, or even medication that can help you manage emotional distress and improve your mental and sexual health. Therapy, in particular, can be a great option for addressing underlying emotional challenges. Cognitive behavioral therapy, CBT, or counseling can help you work through negative thought patterns, reduce anxiety, and build healthier emotional habits. Couples therapy may also help improve communication with a partner, leading to a more fulfilling and connected sex life. Physical activity is another powerful tool for improving both mental and sexual health. Exercise promotes the release of endorphins, the body's natural mood enhancers, which can reduce stress, improve mood, and increase overall well-being. Regular physical activity can also boost self-esteem and confidence, making it easier to engage in sexual activity and enjoy intimacy. Mental health is closely tied to sexual health, and addressing emotional challenges can lead to a healthier, more fulfilling sex life. By seeking support, practicing self-care, and engaging in positive lifestyle changes, elderly men can improve their mental well-being and, as a result, enhance their sexual health. As we age, many elderly men find themselves managing chronic health conditions, and with those conditions often come medications that can impact various aspects of health, including sexual function. Medications prescribed for conditions such as hypertension, diabetes, depression, and heart disease can have side effects that interfere with libido, erectile function, and overall sexual health. It's essential to be aware of how these medications may affect sexual performance, and to have an open conversation with your healthcare provider about potential solutions or alternatives. One of the most common types of medication that can affect sexual function is those used to treat high blood pressure. Certain antihypertensive drugs, such as beta blockers and diuretics, can reduce blood flow to the penis, making it more difficult to achieve or maintain an erection. This can lead to erectile dysfunction, ED, a common concern for elderly men. If you are taking medication for high blood pressure and notice changes in sexual function, it's important to speak with your doctor. In some cases, adjusting the dosage, switching to a different type of medication, or adding an erectile dysfunction treatment can help alleviate these side effects. Similarly, medications prescribed for diabetes can also affect sexual health. Diabetes can lead to nerve damage, which may result in decreased sensation in the genital area, and poor blood circulation can contribute to ED. Medications used to manage diabetes may have side effects that further exacerbate these issues. If you have diabetes, it's crucial to manage your blood sugar levels effectively and work with your healthcare provider to find medications that minimize impact on sexual function. Antidepressants and anti-anxiety medications are another category that can influence sexual health. Selective serotonin reuptake inhibitors, SSRIs, a common class of antidepressants, are known to reduce sexual desire and arousal in many men. These medications can delay orgasm or even make it more difficult to experience sexual pleasure. If you're on medication for depression or anxiety, it's worth discussing the side effects with your doctor, as there may be alternative medications or treatment options available that are less likely to affect sexual function. Some medications used to treat prostate issues, such as benign prostatic hyperplasia, BPH, can also lead to sexual side effects. For example, alpha blockers, which are commonly prescribed to relax the muscles in the prostate and bladder, can affect erectile function and ejaculatory response. Your doctor may recommend adjusting your treatment plan or adding complementary therapies to address these issues. It's important to remember that many medications can have sexual side effects, but not all men will experience them. If you do notice changes in sexual function, don't be afraid to bring it up with your healthcare provider. There are often ways to manage these side effects, whether it's through adjusting your medication, adding treatments like Viagra or Cialis for ED, or incorporating lifestyle changes such as exercise and dietary adjustments. Your sexual health is just as important as any other aspect of your well-being, and your healthcare provider can work with you to ensure that both your medical needs and your sexual health are well managed. One of the key reasons elderly men should reevaluate their sexual health is the opportunity it provides for better communication and connection with their partners. As we age, changes in sexual health are inevitable, but the way we approach these changes within our relationships can make a significant difference in how we experience intimacy. Open and honest conversations about sexual health can not only address concerns but also strengthen relationships and enhance emotional intimacy. For many older men, there may be a reluctance to discuss sexual health with a partner. The stigma surrounding aging and sexuality often leads to embarrassment or avoidance of sensitive topics. However, when both partners are on the same page regarding their sexual health, it can lead to a more fulfilling and mutually satisfying sex life. Having an open conversation about changes in sexual function, desires, and preferences allows couples to make adjustments and find new ways to connect intimately, even if the nature of their sexual activity evolves. Discussing sexual health with your partner can help relieve any anxiety or frustration that might arise from changes in sexual performance. It can also create an opportunity for empathy and understanding. Many older couples experience a shift in their physical relationship, but that doesn't mean the emotional connection has to fade. Instead, by acknowledging and embracing these changes together, couples can find ways to continue sharing intimacy in a way that feels fulfilling for both partners. Sometimes, the decline in sexual function in older men is tied to deeper emotional or psychological factors, such as stress, anxiety, or depression. Having a candid conversation with your partner about how you're feeling mentally and emotionally can help you both navigate these challenges together. Your partner may be more understanding and supportive than you expect, and this can strengthen the bond between you, both sexually and emotionally. In addition to fostering communication about sexual health, talking openly about needs, boundaries, and desires is essential for maintaining a healthy and satisfying sex life. Sexual preferences can change over time, and having a dialogue about what feels good or what no longer works allows both partners to adapt and keep their intimacy fulfilling. Whether it's exploring new forms of touch, intimacy, or affection, understanding each other's needs can enhance the overall relationship and ensure both partners remain satisfied. If the changes in sexual health are causing tension in the relationship, couples therapy or sex therapy may also be helpful. A professional can guide you and your partner through the process of discussing sexual health and intimacy in a constructive and supportive way. Ultimately, taking the time to openly discuss sexual health with your partner fosters a deeper emotional connection, enhances sexual satisfaction, and helps couples navigate the changes that come with aging together. As men age, it's easy to overlook the importance of sexual health in the context of overall well-being. However, sexual health plays a significant role in maintaining not just physical health but also emotional and mental well-being. For elderly men, reassessing and addressing sexual health can enhance the quality of life in a variety of ways, from improving relationships to boosting self-esteem and even enhancing physical health. One of the most immediate benefits of reevaluating sexual health is improved self-confidence. Sexual vitality is often closely tied to self-esteem, and as men age, experiencing challenges in sexual performance or desire can lead to feelings of inadequacy or frustration. By taking steps to address these concerns, whether through medical treatments, lifestyle changes, or open communication with a partner, men can regain confidence in their ability to experience pleasure and intimacy. This boost in self-esteem can positively impact other areas of life, including social interactions, work, and general happiness. Moreover, regular sexual activity itself has a range of physical health benefits. Engaging in sexual activity can improve blood flow, reduce stress, and release endorphins, all of which contribute to overall health. Sex can also help maintain hormonal balance, which is crucial for both emotional well-being and physical health as men age. Regular sexual activity, whether alone or with a partner, can promote better sleep, reduce feelings of anxiety or depression, and improve the immune system. These benefits all contribute to a higher quality of life as men grow older. Reassessing sexual health can also improve relationships. As we discussed earlier, open communication with a partner about changes in sexual health is essential for maintaining intimacy and emotional closeness. When couples work together to address sexual challenges, it can strengthen the bond and foster a deeper connection. For many elderly men, the intimacy shared with a partner is a source of emotional fulfillment and support. By taking proactive steps to maintain sexual health, men can continue to enjoy a fulfilling and loving relationship for years to come. Additionally, maintaining a healthy sex life can provide an opportunity to explore new forms of intimacy that may be more suitable to changing physical abilities. Even if traditional forms of sex become more difficult, men can experiment with different ways of connecting with their partner emotionally and physically. Non-sexual physical intimacy, such as cuddling, holding hands, or simply being close, can also foster emotional well-being and strengthen the relationship. Finally, taking the time to focus on sexual health and address any concerns related to sexual performance can contribute to an overall sense of fulfillment and well-being. Sexual health is an important component of life satisfaction, and when men take charge of their sexual health, they are better equipped to enjoy a more active, confident, and fulfilling life. In conclusion, reassessing your sexual health as an elderly man is not only about maintaining sexual function but also about enhancing your overall quality of life. By addressing sexual health concerns, seeking medical advice, and maintaining open communication with your partner, you can continue to enjoy the benefits of intimacy, emotional connection, and personal satisfaction. Reevaluating your sexual health as an elderly man is a critical step in maintaining a fulfilling, active, and confident life as you age. Addressing issues such as hormonal changes, mental health, medications, relationship communication, and overall self-care can significantly improve not just your sexual well-being but your quality of life in general. Remember, it's never too late to take control of your health, and the positive impact it can have on your relationships and personal happiness is well worth the effort. If you're noticing changes in your sexual health, don't hesitate to speak with your healthcare provider. By taking the time to assess and address these concerns, you're investing in your future, and in your ability to enjoy a satisfying and vibrant life as you grow older. If you found this video helpful, be sure to subscribe to our channel for more tips and advice on living your best life as a senior. Don't forget to like, comment, and share with others who may benefit from this information. We're here to help you thrive, every step of the way.